Hello everyone, thanks for clicking on this video. Let me introduce myself. I am Dr. Tamran Govender, an Ayurvedic doctor, TRE facilitator, and life coach. In this video, we will be delving into the world of Ayurvedic medicine, exploring how Ayurveda works beyond the traditional home remedies, which many of you may be familiar with. We'll explore an array of scientific research and clinical studies that are shining a new light on how Ayurveda can be integrated into the modern healthcare practice. I will then touch on some of the basic principles of this modality to give you a better understanding of how it works. So, whether you're already familiar with Ayurvedic principles or you're new to this ancient holistic healthcare system, there's something here for everyone. This is a general overview of what will be covered in this video. When we discuss integrating Ayurveda into the realm of evidence based medicine, we require a structured approach. We need clarity. We also need categories that enable researchers and clinicians to communicate effectively. That's exactly what this slide is about. We've categorized all Ayurvedic clinical research into five key areas to ensure clarity and targeted outcomes. So let me talk you through them briefly. The first category is your disease focused Ayurvedic interventions. Here we'll be targeting major public health issues like HIV, SLE, and even precancerous lesions. These are areas where Ayurvedic interventions can make a measurable difference. The second is your single Ayurvedic herbs. Now think of herbs like tulsi, ashwagandha, and brahmi. Each of these has centuries of usage, and now we're backing them up with clinical research. The third category is your proprietary medicines. Formulas like Abana or Ayush 64, which are already in practice, are now undergoing validation for specific conditions. The fourth category is your single isolated compounds. This is where traditional wisdom meets modern pharmacology. Isolating compounds like berberine or vincristine to test their mechanism scientifically. The last category is your proven alternatives amla versus statins, kapikachu versus L-dopa. Here, we directly compare Ayurvedic and allopathic treatments to evaluate efficacy, safety, and cost effectiveness. So let's start with the disease focused Ayurvedic interventions. Guruji Ganavati is an Ayurvedic preparation made from the aqueous extract of Tinospora cordifolia, commonly known as Guruji or Giloy. This is a popular Ayurvedic herb. Now, Guruji is known for its immunomodulatory properties, helping to strengthen the immune system and protect against infections, viruses, and bacteria. It also helps manage fever, which is a common symptom of COVID 19, and it alleviates associated symptoms like fatigue, body aches, and respiratory discomfort. So, by reducing inflammation and clearing mucus, it can help manage mild respiratory symptoms associated with COVID, such as cough or breathlessness. Now, among the 10,022 participants who completed the study, the incidence of COVID infection was found to be lower in those taking Guruji Ganavati compared to the control group. Apart from this, in India, there have been several initiatives that were taken to utilize the vast potential of Ayurveda during the pandemic. The Ministry of Ayush, a nodal ministry of complementary and alternative medicine, has also released a set of guidelines for boosting immunity and measures for self care by using Ayurvedic principles. The Indian Prime Minister, in his address to the nation, also mentioned the use of Ayurvedic medicines for improving immunity against COVID. This has led to a surge in demand for Ayurvedic medicines. Next, SLE. So, this is a chronic autoimmune disorder where the body's immune system attacks its own tissues, causing inflammation and damage to organs such as the skin, joints, kidneys, heart, and lungs. Symptoms include fatigue, joint pain, skin rashes, often a butterfly shaped rash on the face, fever, and organ specific issues like kidney inflammation. Now, triggers may involve genetics, environmental factors, or hormonal changes, with women being more susceptible, possibly due to estrogen. When it comes to treating SLE from an Ayurvedic standpoint, the treatment is a multifaceted approach, focusing on removing the accumulation of metabolic toxins, strengthening digestion, modulating immunity, and protecting the tissues from the damage caused by antibodies, as well as correcting the deep seated pathology. The result of the clinical trial on the screen demonstrated a 60% improvement in the cardinal features like pain, oral ulcers, and malarash. Then moving on to HIV. So HIV specifically targets CD4 and T lymphocytes by binding to the CD4 receptor on their surface, using it to enter and infect the cells. Once inside, HIV replicates, leading to the destruction of the infected CD4 cells. Over time, HIV infection reduces CD4 cell counts as the virus kills the cells faster than the body can replace them. This progressive depletion weakens the immune system, increasing susceptibility to opportunistic infections. So, here are three clinical studies demonstrating the effectiveness of certain Ayurvedic herbs and formulations for HIV and AIDS. The first we have is neem, and this is often recognized for its potent immune boosting properties. In a clinical trial, HIV patients given neem experienced a significant increase in CD4 cell count. Then we have calamig, with andrographolide being its bioactive constituent, and this has also shown to increase CD4 cell counts in HIV positive patients, primarily by inhibiting HIV induced cell cycle dysregulation, potentially reducing CD4 and T cell apoptosis, or promoting the proliferation. And lastly, we have Shiva Gotika. This Ayurvedic formulation improves strength, immunity, and it recuperates the weakness of the body tissues. It also improves hemoglobin, body weight, BMI, and as well as CD4 cell count. Then it comes to precancerous lesions. So Triphala is the formula that we use here, and this is a traditional Ayurvedic herbal formula made from three dried fruits, namely amlaki, haritaki, and vebitaki. So the name Triphala means three fruits in Sanskrit, and is typically consumed as a tablet, a powder, or a capsule. So the results of the following study of Triphala mouth rinse showed promise in reversing precancerous oral lesions, including oral submucosal fibrosis, due to its antioxidant and anti-inflammatory properties, as well as its collagen modulating properties, which contribute to reducing fibrosis and malignant potential. Then moving on to your single Ayurvedic herbs. Tulsi provides immune support. So, a group of participants who were given Tulsi showed a significant increase in interferon gamma, interleukin 4, and percentages of T helper cells compared to the placebo. The benefits of this herb are attributed to its bioactive compounds, namely eugenol and flavonoids, which help reduce oxidative stress, modulate inflammation, and enhance immune cell activity, helping prevent infections and supporting immune system balance. Then we have ashwagandha. So, this herb improves neuropsychiatric care. There are numerous clinical trials on this herb demonstrating its adaptogenic properties, which is essentially the ability to cope with stress. Ashwagandha also modulates the HPA axis, reducing cortisol and promoting GABAergic activity, which calms the nervous system. This herb is recognized for its ability to reduce stress, anxiety, and improve conditions like depression, OCD, mild cognitive impairment, and sleep. This may be due to its neuroprotective and anti inflammatory properties. Then we have Brahmi. This herb reduces symptoms of inattention, hyperactivity, and impulsivity. 31 children aged between 6 and 12 were given an extract of Bacopa monnieri with 225 milligrams per day for ADHD. Brahmi is a part of a group of herbs known as Media which are essentially nootropic herbs. They are specifically prescribed to improve memory, concentration, and learning capabilities. The study demonstrated the following: a 93% reduction in restlessness, 67% reduction in impulsivity, a 78% reduction in learning problems, and a 52% reduction in psychiatric problems. 74% of children's total subtest scores improved by at least 20%, with the treatment being well tolerated and with minimal side effects. Then we have Vibitaki. So this herb's antioxidant properties are specifically due to polyphenols, and it may counteract oxidative stress linked to hyperuricemia, potentially reducing comorbidities like cardiovascular disease. Its anti inflammatory effects may also mitigate gout flares. But besides gout, hyperuricemia is often linked to cardiovascular diseases, chronic kidney disease, metabolic syndrome, and hypertension. In this study, however, the use of Vibitaki was effective in treating this condition with no serious side effects. Then moving on to your proprietary medicines. First is Abana. So Abana has potent antihypertensive effects that stem from its polyherbal composition, including key ingredients like arjuna, gugulu, ashwagandha, and other herbs. Abana is particularly effective in patients with hypertension associated with high cholesterol or abnormal lipid profiles. It is less effective for severe hypertension but can serve as an adjuvant to support cardiac health. It also lowers total cholesterol, triglycerides, LDL, and VLDL while increasing HDL. This lipid normalizing effect reduces arterial stress and supports blood pressure control. Studies have also demonstrated that Abana improves diastolic function and pump function, reducing preload and afterload, which contributes to its antihypertensive and cardioprotective effects, especially in conditions like ischemic heart disease. It is important to note that Abana is not effective as a standalone treatment for severe hypertension, but again, it can be used as an adjuvant. Then we have Septilin. This is also a polyherbal formulation and it has potent antioxidant and anti inflammatory, anti allergic, and antimicrobial properties. It also enhances one's natural immunity. This makes it an effective and natural solution for respiratory tract infections. In this study, multiple clinical trials were analyzed, and Septilin was found to be effective in managing upper and lower respiratory tract infections, chronic nonspecific pharyngitis, tonsillitis, sore throat, cough, and nasal congestion, with a favorable safety profile and no significant side effects when taken as prescribed. Then we have Diabicon. So this has the following key ingredients. The first is gymnema, and this helps reduce glucose absorption in the intestines and it enhances insulin secretion by regenerating beta cells. Then we have trikatu, which improves the bioavailability of other herbs and supports metabolic health. Then we have betamelin, which contains charantin and polypeptide P, which mimics insulin and improves glucose utilization. Now, diabicon is one of the most well studied Ayurvedic formulations for diabetes. Apart from it reducing blood sugar and lipids, it has also been found to help prevent factors responsible for the development of diabetic retinopathy. Clinical data suggests that Diabicon helps normalize blood sugar levels in pre diabetic patients, preventing the need for allopathic drugs in early stages. This is because some of the key ingredients help protect pancreatic cells and improve insulin sensitivity. Apart from this, it also reduces fasting blood sugar, postprandial blood sugar, and HbA1c. It also reduces carbohydrate absorption. and it improves lipid profiles. Some studies have shown that it can reduce the need for insulin in type 1 diabetics as well. This is due to some of its ingredients having insulin secretagogue properties. Lastly, it helps with the peripheral utilization of blood glucose and helps restore hepatic and muscle glycogen stores, thus helping with energy levels too. Then we have Ayush 64. So the results of Ayush 64 demonstrated remarkable improvement in the symptoms of patients after its administration as an adjuvant to standard care. It's limited. It's this formulation has limited the progression of the disease in mild to moderate COVID cases, and none of the patients required hospitalization. The symptoms began to subside just within 2 to 3 days of treatment. Research on IU64 indicates that its phytochemical components exhibit a strong binding affinity to the COVID 19 virus. The formulation demonstrates notable antiviral, antioxidant, immunomodulatory, and fever reducing properties, and it has been effectively used in treating conditions such as malaria, microfilaria, and chikungunya, as well as influenza. As a result of this, the government of India repurposed IU64, integrating it into the national COVID 19 management protocol as a potential complementary treatment alongside standard care for asymptomatic, mild, and moderate COVID 19 cases. Next is our single isolated compounds. Nitya Kalyani has been used in traditional Ayurvedic medicine. Most clinical trials focus on the isolated alkaloids, namely vinblastin and vincristin, rather than the whole herb, as the raw plant is actually toxic and requires processing for safe use. These vinca alkaloids have been studied since the 1950s and are recognized for their versatility in cancer therapy. They form a part of the original cancer therapies. A 1958 study tested vinblastin in patients with Hodgkin's lymphoma and other hematological malignancies, leading to its widespread use as a single agent and in combination therapies. Berberine activates AMP activated protein kinase, improving insulin sensitivity, glucose uptake, and lipid metabolism. It also reduces hepatic glucose production and enhances GLP-1 secretion. Trials show that 500 to 1,500 milligrams of berberine a day lowers blood glucose, HbA1c, and insulin resistance in type 2 diabetes, with effects comparable to metformin in some studies. Berberine also reduces cholesterol. A systematic review and meta analysis of 16 randomized control trials evaluated berberine's effects on metabolic disorders. The results indicated a significant reduction in triglycerides, total cholesterol, and fasting plasma glucose while increasing HDL. Berberine is recognized for its ability to regulate glucose and lipid metabolism, reduce HbA1c, fasting blood glucose, postprandial blood glucose, and plasma triglycerides. It is also effective in improving hormonal health, especially in PCOS. It reduces CRP, which is a common inflammation biomarker, and is extremely beneficial in reducing the recurrence of colorectal polyps. Then we have gymnemic acid. This is a bioactive compound found in the gymnema plant. A study involving 27 patients with type 1 diabetes receiving insulin therapy showed that an extract of Gymnema sylvester leaves reduced insulin requirements, fasting blood glucose, and improved glycemic control. Gymnemic acid reduces the desire for high sugar foods in adults, which is attributed to its ability to block sugar receptors on taste buds, contributing to its hypoglycemic effects. This demonstrates that gymnemic acid may enhance insulin action, potentially through pancreatic beta cell regeneration or increased insulin secretion. Then moving on to our proven natural alternatives. Simvastatin is a drug which I'm sure many of you are familiar with, and it's used for treating elevated cholesterol levels. It is a part of the group of drugs commonly known as statins, and the long term side effects of these drugs can lead to high blood sugar, headaches, dizziness, anemia, liver toxicity, and kidney failure. Amla, on the other hand, is a fruit that has been commonly used in Ayurvedic medicine for centuries. It is one of nature's richest sources of vitamin C. Now, we commonly use amla to treat gastroesophageal reflux disease, anemia, and diabetes. In a clinical trial, amla was compared to simvastatin and was found to be just as effective in reducing cholesterol levels, with the added benefit of reducing blood pressure. Then we have kapikachu versus L-Dopa. So, kapikachu is also known as the Mucuna prurins, and this is a natural source of L-Dopa or levodopa, a precursor to dopamine. The seeds contain 3 to 6% of L-Dopa, which is traditionally used in Ayurvedic medicine for neurological conditions like Parkinson's disease. L-Dopa crosses the blood-brain barrier, converting to dopamine, which helps regulate movement and mood. This herb has been studied for its potential to manage Parkinson's symptoms due to its L-Dopa content, often showing efficacy comparable to synthetic levodopa, but with fewer side effects. Some of the other benefits of this herb include an improvement in your mood, libido, and cognitive function due to dopamine's role. Then we have Triphala and chlorhexidine. This Triphala is a cost-effective solution for periodontal disease. Triphala mouthwash consistently shows anti-plaque, anti-gingivitic, and antimicrobial effects comparable to 0.2% of chlorhexidine in multiple trials, with no significant statistical differences in most cases. Trifala's benefits and efficacy are attributed to its natural composition, with fewer side effects, as well as its antioxidant, anti inflammatory, and antimicrobial properties. Then we have Rumalea gel and ibuprofen. So, Rumalea gel is just as effective for musculoskeletal disorders. A study published in the Himalaya Update compared Rumalea gel with diclofenac sodium gel for soft tissue injuries and inflammatory musculoskeletal disorders. Both treatments effectively reduced joint and muscle pain, with Rumalea gel showing comparable efficacy and safety to diclofenac gel. This suggests that Rumalea's topical formulation could be an alternative to your typical NSAIDs, like those containing ibuprofen. So Rumalea's herbal composition includes ingredients like Boswellia serrata and guggul, which provide anti-inflammatory and analgesic effects that rival NSAIDs. A 2015 randomized double-blind placebo-controlled trial evaluated Rumalea Fort against paracetamol in 40 patients with hand osteoarthritis. After 6 weeks, Rumalea Fort reduced pain by 31.7% versus 25.8% for paracetamol, and morning stiffness by 37.2% versus 30.5%. Rumalea Fort also significantly improved hand function. There were no significant adverse events reported in either group. Now, while the study compares Rumalea Fort to paracetamol, it highlights its efficacy against a common analgesic, suggesting potential comparability to ibuprofen in similar contexts. Rumalea consistently shows a favorable profile with no significant adverse events, unlike ibuprofen, which carries risks of toxicity, renal injury, and hypersensitivity reactions. So, here are a list of evidence based Ayurvedic remedies. So, let's touch on just a few. So, ginger is effective for diabetes and dysmenorrhea, and this stems from its bioactive compounds, primarily gingerols, shogols, and paradols, which exhibit anti inflammatory, antioxidant, and analgesic properties. Then we have amla. This is often used in anemic conditions, like I've mentioned, and this is due to its rich nutrient profile and bioactive compounds, which support red blood cell production and iron absorption. It is also a rich source of vitamin C, iron, folic acid, and vitamin B. Then moving on to rosemary. So rosemary contains ursolic and carnosic acids, which improve blood flow to the scalp and enhances circulation and delivers more oxygen and nutrients to hair follicles, supporting growth and reducing hair thinning. It also inhibits 5-alpha reductase, an enzyme that converts testosterone to DHT. Excess DHT is often linked to androgenetic alopecia, so reducing DHT levels can slow down hair loss. So, the misconception. There's a common myth that Ayurveda is just folk medicine and home remedies. In reality, it is a codified, evidence based medical system that has existed for over 5,000 years. And it is rooted in diagnosis, treatment protocols, and preventative and curative healthcare. The term Ayurveda is derived from two Sanskrit words, Ayur, which means life, and Veda, which means knowledge or science. Therefore, Ayurveda can be translated as the science of life or the knowledge of life. It is a comprehensive medical system that has 8 branches of healthcare, namely internal medicine, pediatrics, psychiatry, ENT, ophthalmology, surgery, toxicology, geriatrics, and sexology. So, where did Ayurveda originate from? So, like I've mentioned, it's a 5,000-year-old medical system, but it originated from India and is often called the medicine of longevity because people were said to live over 100 years using its practices. Ayurveda is also called the mother of healing because it influenced other ancient medical systems like Tibetan medicine, Chinese medicine, and Greek medicine. Its roots lie in the Vedas, the oldest Sanskrit texts, which were first shared orally from teacher to student before being written down between 1500 and 500 BCE. Ayurveda is especially connected to the Atharva Veda and is considered a part of it, not something added later. The Atharva Veda contains references to Ayurveda, including ways to treat injuries, maintain health, and support fertility. These great sages devoted their lives to studying how to keep people healthy. Over time, they compiled their knowledge into texts called Samhitas. These texts were refined over centuries, and the three most important works are known as the Brihat Trayi. And these are Charak Samhita, Shushruta Samhita, and Ashtanga Hridayam. These books detail diseases, treatments, and medicinal plants. Ayurveda's formal development continued from the 6th century BCE to the 7th century CE, known as the Samhita period, when many classical texts were written and organized medical care systems emerged. So, what is the main objectives? What are the main objectives when it comes to Ayurvedic medicine? There are two: preventative healthcare and curative healthcare. So, in terms of preventative healthcare, Ayurveda places great emphasis on maintaining the healthy state of a human by following a daily regimen, seasonal regimen, and specific codes of conduct. When it comes to curative healthcare, however, there is no doubt that conventional medicine has been successful in trauma and medical emergencies, but it fails to focus on establishing health in an individual. This is achieved through treatments that are conducted in Ayurveda, known as panchakarma, where the factors of diseases are removed through various therapies. Ayurveda adopts the premise that as the elements are present in the macrocosm, the universe, they are present in the microcosm, the subtle human body. This is involving your cells, your tissues, and your organs. So, Ayurveda operates on the core principle that the universe is composed of 5 elements, namely fire, water, earth, ether, and air. Collectively, these elements are known as the Pancha Mahabhutas, also known as nature's five great elements. And any imbalance of these elements in the human body results in disease. So, the role of these five elements in our body is as follows. So, the ether element is associated with openness and expansiveness of the body, facilitating communication between different bodily systems. The element of air is associated with movement, circulation, and the functioning of the nervous system in the body. The element of fire is associated with metabolic processes, digestion, and transformation of food into energy in the body. Water is associated with bodily fluids, including blood, lymph, and saliva, as well as maintaining fluid balance and nourishing the cells. And lastly, earth is associated with the solid structures of the body, such as your bones, muscles, and tissues. So, doshas are active pathological factors that are present in our bodies. An imbalance of these factors give rise to disease and can be corrected by Ayurvedic treatment. When the doshas are in equilibrium, a person is considered healthy. So, the first one is kapha, and this governs the structural and functional integrity of the body. It is present in all fluid systems, such as synovial fluid and cerebrospinal fluid. Then we have Pitta dosha, and this is responsible for all digestion and metabolism in the body. It also imparts color, temperature, and regulates our hormones. Vata is responsible for all motor and sensory nervous system functions, and it is the principle that allows us the ability to initiate natural urges of the body. So when two elements are combined, they essentially form these doshas. So the combination of ether and air form vata, which is the principle of movement, and these are all your catabolic reactions in the body. Combination of fire and water form pitta, which is your principle of transformation, and these are all your metabolic reactions in the body. And then we have the combination of earth and water, which form kapha, which is the principle of cohesion. And these are all your anabolic reactions in the body. Now, before we get into the crux of understanding the vast concept of Agni or metabolism, let me break down the deeper understanding of cellular metabolism from an Ayurvedic standpoint. Autophagy is like the process of cleaning up waste in our cells, and apoptosis is when cells die in an organized way. And cellular proliferation refers to the growth of new cells. Now, when autophagy doesn't work well, cellular waste piles up and causes inflammation. Now, for instance, in Alzheimer's disease, there are protein clumps called amyloid plaques, which form due to this waste buildup. And these plaques are harmful to the brain. This is what we would call as ama in Ayurveda, which is essentially neurotoxic waste that eventually leads to degenerative changes within the brain. If apoptosis is not regulated properly, it can lead to problems. And if it happens too quickly, it can cause degeneration, like in Parkinson's disease. On the other hand, if it's too slow, it can lead to excessive growth, like in cancer. So, when there is too much cellular proliferation, it can cause excess growth, as seen in conditions like cancer or psoriasis. But if it happens too slowly, it can lead to degeneration. Now, in almost every autoimmune condition, autophagic deficiencies are seen. In cancer, due to DNA damage, cellular proliferation of abnormal cells occurs. These cells are often hidden from the immune system, and as a result, they cannot be targeted and killed via apoptosis and cleared with autophagy. Now, in Ayurveda, we primarily focus on this aspect of the disease. This is what we refer to when we say that we focus on the root cause. Now, when Agni or metabolism is imbalanced, individuals may experience symptoms such as indigestion, gas, bloating, fatigue, and an increased susceptibility to illnesses. There can also be irregular bowel movements, constipation, or diarrhea that can occur. Ayurveda provides guidelines for maintaining and restoring a balanced Agni. This includes dietary recommendations such as eating according to one's constitution, known as Prakriti, and current imbalances known as Vikruti, as well as adopting lifestyle practices. There are certain herbs and spices that improve the function of our digestive capacity, such as ginger, cumin, and fennel. And these can be incorporated into one's diet to support Agni. Now, according to Ayurveda, undigested food and metabolic waste can lead to the formation of ama, which, like I mentioned, is a toxin. So, when your Agni or your metabolism is weak or imbalanced, can lead to incomplete digestion and the accumulation of ama in the body. AMA is linked to various health issues and is a key factor in the development of diseases. And this is why periodic detoxification practices such as panchakarma are used in Ayurveda to cleanse the body of accumulated toxins and to rejuvenate the digestive system, thereby improving metabolism. So, what does Ayurveda truly encompass? It is a holistic and personalized medical system based on doshas, which I've mentioned, Agni, Dhatus, which are your tissues, Mala, which is your excretory products, and Srotas, which is the channels of the body. It also uses Prakriti Vikriti analysis to individualize care. Practices include daily regimen and seasonal care. And there are aspects of Ayurveda that also include surgery, pharmacology, and advanced therapeutics. In Ayurveda, we get to the root of the problem so that it does not reoccur. The maintenance of health is our aim as practitioners. Every individual has their own unique Ayurvedic body type. When analyzing treatment and diet, an Ayurvedic physician considers these factors. Techniques include analyzing the pulse, the physical and mental characteristics, as well as the tongue. The ratio of the elements differs from individual to individual. Therefore, there is no one size fits all treatment protocol. Here is a summarized breakdown of the core principles of diagnostic tools practitioners use to diagnose and treat various diseases. First, we have is Trivida Pariksha. This is a threefold examination involving three key components, namely inspection, palpation or percussion, and interrogation. This is the key diagnosis that practitioners use to identify underlying imbalances or diseases. Then we have Ashtaveda Pariksha. These are 8 factors that we examine to diagnose a patient. And then these are the 10 factors that we have to diagnose as well. And this is the Ayurvedic diagnostic principles compared to modern. So there are some aspects of it that are very similar. Ayurvedic treatment outcomes vary based on the condition, the individual constitution, and an adherence to the regimen. Ayurveda focuses on holistic balance, personalized care, and natural treatments. The results also depend on the patient's commitment as well as the nature of the ailment. So Ayurveda aims to balance the functional biomechanisms known as Vata, Pitta, and Kapha, thereby enhancing physical, mental, and emotional health. Patients often report increased energy, better sleep, and reduced stress. Conditions like arthritis, digestive disorders such as IBS, skin issues such as eczema, anxiety, hormonal imbalances, etc., may see symptom relief through diet, herbs, and therapies like panchakarma. Outcomes include reduced pain, better digestion, clearer skin, and regular menstrual cycles. Ayurveda also places great emphasis on gut health. Specific Ayurvedic formulations may be recommended as well as dietary and lifestyle adjustments, which improve digestion, reduce bloating, and enhance nutrient absorption. There are also practices like meditation, yoga, and shirodhara, which is essentially the pouring of oil on the forehead, that help reduce anxiety, depression, and insomnia. Patients often report better mental clarity and emotional stability. When it comes to panchakarma therapies, there are 5 types. And they aim to remove deep seated metabolic toxins, which I've mentioned, known as AMA. So, outcomes include improved organ function, clearer complexion, and increased vitality, though these are intensive and require strict post treatment protocols and are only recommended in chronic conditions. Ayurveda's focus on prevention through lifestyle and rejuvenation therapies help delay aging signs, boost immunity, and reduce disease risk over time. With all of these steps in place, overall immunity, strength, and health improve, allowing one to bounce back faster from infections. So, what is the relevance of Ayurveda in the modern world? Ayurveda promotes a holistic approach to health, addressing not only physical but also mental and emotional well being. This approach aligns with modern wellness trends, emphasizing the interconnectedness of different aspects of health. A strong emphasis is also placed on preventative healthcare, offering lifestyle guidelines that help individuals maintain health and prevent diseases. In a world burdened by lifestyle related diseases, this preventative aspect is highly relevant. We also recognize that each person is unique and treatments are tailored according to individual constitution and imbalances. This personalized approach aligns with the emerging field of personalized medicine. Ayurveda also relies on natural remedies, herbs, and lifestyle adjustments. In a world increasingly concerned about the environmental impact of pharmaceuticals and chemicals, Ayurveda's natural and sustainable practices are relevant. This medical system is gaining recognition in the scientific and medical communities. Research is providing evidence for the efficacy of Ayurvedic practices and remedies, further enhancing its relevance. It is also spreading worldwide, and people are increasingly turning to it as an alternative or complementary healthcare system. This global acceptance underscores its relevance in the modern world. With the rise of lifestyle related health issues such as obesity, diabetes, and stress related illnesses, Ayurveda's emphasis on lifestyle, diet, and stress management becomes increasingly important. Ayurveda also offers insights and treatments for chronic conditions, providing an alternative or supplementary approach to managing these long term health challenges. So when it comes to global recognition and integration, there have been more published studies in journals like PubMed. Which have demonstrated benefits in managing chronic illnesses like arthritis, IBS, diabetes, and skin disorders. The World Health Organization has also endorsed a traditional medicine strategy that has helped legitimize traditional systems like Ayurveda. The World Health Organization has also opened a global center for traditional medicine, which was established in India in 2022. There have also been other government initiatives. And the Indian Ministry of Ayush promotes Ayurveda education, research, and international collaborations. There have also been MOUs that are signed between India and countries like Germany, Japan, and South Africa. Functional medicine, integrative medicine, and holistic health approaches are also incorporating Ayurvedic concepts such as gut health and circadian rhythms. And with the growing awareness of Yoga Day, this has also opened up the door for Ayurveda by sharing the same philosophical roots. And apart from this, there's also an increasing demand for natural, preventative, and personalized healthcare. There's also growth in Ayurvedic cosmetics, supplements, and wellness tourism. And also, public figures in Hollywood and wellness communities often promote Ayurvedic diets, therapies, and skin routines. So, to sum it up, we are not replacing biomedicine, but expanding the therapeutic toolbox with millennia old knowledge that aligns with modern chronic care. I hope you enjoyed this video. Please don't forget to subscribe and hit the like button.